Aside from the brain for surgery, what are the most common, what we call peripheral nerve damage that you do handle from day to day?
Well, among the most common things that patients might experience and primary care physicians might see would be peripheral nerve entrapment, such things as carpal tunnel syndrome with entrapment of the nerve in the palm. Very common. People get it when they ride their bikes. They can get it from typing too much. Very common. Cause symptoms at night, horrible numbness and pain. It can be identified clinically in the office with simple testing, confirmed by electrical test neurologists too, and then simple small surgeries can correct it. Another common entrapment would be an ulnar nerve entrapment. The so-called funny bone is the ulnar nerve in the inner elbow, and that can become in trouble if there's too much flexion of the elbow or trauma to the area, a fracture previously. These are things that can lead to numbness in the outer part of the hand, a different pattern than carpal tunnel syndrome, but commonly identified in the primary care office. And again, it's testable with an EMG, electrical test, and then simply treated with a simple little procedure in the elbow. So these are the peripheral nerve entrapments that are the most common that we see. There are other much more rare ones, but those are by far and away the most common ones. So many people will awaken at night in a funny position and their hand will be numb, and that's usually they have put some strain on their carpal tunnel nerve, the median nerve, or the elbow, the ulnar nerve. And that's something that just you can shake off. And that's not disease. That's simply the way our body is built.
Now, that is great that you mentioned that, because a lot of people, especially in primary care setting, we see a lot of people with these numbness and tingling in the hands. Of course, we all know everybody has heard of carpal tunnel syndrome, but then they don't know the etiology, how it became that case.